Hi everyone, this is Dr. Lin of Rehab and Irvine Physical Therapy. Thanks for tuning in today. Today we're going to talk about decompressing your spine. A lot of people get on those inversion tables all the time and they hurt themselves. So stay tuned and find out what's going to happen next, and we'll show you the right way to get about it. Welcome back. So, how do you decompress your spine? And we're going to use our favorite thing that is universally out there. It's gravity. We're going to talk about this suspended prone. I learned this through the Institute of Physical Art, through my functional manual therapy training. So I have to give them credit. I didn't think of this myself, but I just use this with a lot of my degenerative joint population, as well as those just having sometimes a big flare up. So what you want to do is you find you can either use an island at a kitchen table, or if you got a nice little table, or if you got a massage table like this, just be careful. You maybe want someone on the other end. But a great thing to do is put a pillow here so you can create a little bit of a bow. Make sure you check with your healthcare professional, because this isn't for every back type of symptom. So what you want to do here is you want to be able to get yourself over this pillow and get this nice little hinge. So make sure you get this nice little hinge. And then what we're going to do is here, you're going to turn and prop the top of your toes up here, and then you're going to let gravity do its thing. You might feel a lot of pressure in your stomach. That's normal. Make sure you empty your bladder. But if not, that's not the case, then just kind of hang out and then let it relax. There's a couple things I actually like to add to this. Sometimes, as you're trying to spread the spine passively, you want to be able to go side to side or forward and back. So sometimes it's whatever floats your boat. So this feels really good right now after my long day, and it's definitely mobilizing a little bit of that. Now you can do that for about a minute. I wouldn't do it any longer because you're really stretching passively the ligaments. So you want to be careful here. And what you're going to do here is then you're going to prop your foot back and you're going to rock yourself straight back. I wouldn't go straight up like a helicopter. So avoid being a helicopter, and I just kind of weight shift here and there, and kind of walk myself closer to the surface, and then I just kind of walk myself up. And that's the correct way to kind of decompress segmentally, or even a specific segments of our L3, 4, 5, sometimes S1 spinal joints. So just a quick review. Once again, what you want to do is you want to get yourself up to something about here. Could be a little higher, could be a little lower, but you really want to be able to press and hinge over that hip joint. Go over the surface with a pillow. Make sure you have a pillow there. It's really important. Empty your bladder, and then also start propping the top of your feet on top. So, and then just let yourself hang. You can then swivel side to side actively, or forward and backwards, and then just walk yourself back up slowly when you're done, so you don't compress. Gravity's coming down fast, so that's a lot of compression and load. So be careful. Double check with your healthcare professional. This is a provocative exercise, but when used adequately or correctly, we can really avoid some of this compression, this pain, or those who always like to pop themselves. So I'm Dr. Lin of Rehab and Revive. Remember, if you like what we're doing, please subscribe below, and leave a comment with us. See if we're doing all right. I'm trying to get better at this, so I love your feedback. It's always helpful. No racist comments though, so we've been erasing those lately. But other than that, I'll see you next time. Remember, we can and we will get better together.